I was reading something in medical news today, and it got me thinking a little bit. How many of you people out there actually use telemedicine services? I am not a big fan of telemedicine services, and I'll explain why. They're a money-making machine for offices, hospitals, etc., because they take no time, they take no resources. If you have a typical in-person doctor's visit that may last 20 to 30 minutes, you can get through a telemedicine visit in just a couple of minutes and still bill for it, and insurance pays for them. The problems I see with telemedicine is you can't do anything. When I examine somebody, I put my hands on them. I like to feel. I put my hands on your chest and feel when you breathe. You can tell a lot about whether there's rattling, vibrations, or whatever. I listen to the neck arteries, listen for carotid bruits. People say, well, you can look at a rash. I'll send you a picture of a rash or whatever. No, it's not that simple. A picture of a rash gives you a two-dimensional image, and rashes have 3 dimensions, and they also have heat and different things that you can't tell on telemedicine. Even psychiatric visits, you want to sit and talk to somebody, you get a lot of information by looking at their body motions, how they present themselves, that just doesn't show very well on telemedicine. Amazon runs telemedicine clinics called One Medical Clinics. I don't know who they hire. I don't know whether they're hiring doctors, nurse practitioners, PAs, what. I don't know that. But they are not spending a ton of money on their providers. And they have been sued numerous times. And one time in particular, a person called in for a telemedicine visit with respiratory problems. The problem is his feet were turning blue. He was coughing up blood. He was having difficulty breathing. And in his wisdom, he decided to go with a telemedicine visit. And of course, they couldn't evaluate him. So their plan of action was to tell him to get an over-the-counter inhaler, which Amazon happened to sell. So they tried to sell this guy an over-the-counter inhaler for an obvious severe problem, and he died. Telemedicine is not the way to go. I don't care what's preached at you and what's thrown at you. If you have to do it in a pinch, fine. But if you have any opportunity to go in person and see your physician in person, that is the way to go. That's just my medical advice of current state of affairs. So stay healthy.